Hey everybody, Dr. Jared Skowron from Spectrum Awakening. Let's get into MTHFR, autism. What is it? What does it do? And how we can help. So what I'd like to show first is a research study. This research study just done a couple years ago, association between MTHFR, C677T, A1298C, and the susceptibility to autism. What it says down there is MTHFR C677T polymorphisms is a susceptibility factor for autism spectrum disorders. Okay, so what the heck does that mean? Because all of a sudden we've got a research study that says this is a risk factor for your child having autism. Okay, that's something we need to know about. We need to know what it is, why it is, and how we can treat it. So let's take a step back. Our bodies have 20,000 plus genes, all right? And they're all really important. They all do different things. Some make our bones, some make our skin, some make our sex hormones, some make us happy, some make us sad, okay? All these different genetics are involved in who we are and how we are. Now, when we talk about genetics and autism, we may be talking about serious genetic conditions like Fragile X or deletion duplication syndromes or other genetic mutation, gene mutation conditions that can cause autism. The other type of genetics we can talk about are the genetics that make us unique, okay? What makes us me? What makes you you? What makes Erica Erica? We all have our different genes that really create us as an individual. So there's genes that are not functioning that cause disease states, and then there's just the unique genes of us, okay? MTHFR is one of the genes of that 20,000 genes that we have, all right? It's really important in making the brain function well. And I'm going to get into all the details of that, okay? MTHFR does not cause a genetic condition or a genetic problem. It is just a gene of who we are. It's a gene of individuality, all right? 50% of the world have this MTHFR gene working perfectly. The other 50% don't, okay? So that's a whole slew of people that have this MTHFR gene not functioning as good as it could be. So it's, 50% of the world don't have a genetic condition. It's just part of who we are. So in autism, as you saw in that first research study, it does increase the risk factor for autism and developmental delays. So let's get into how that happens. Again, it's just a risk factor. It does not definitively cause autism because guess what? 50% of the world doesn't have autism. So we know MTHFR cannot just cause autism because we have all these other billions of people with abnormal MTHFR gene states. So let's figure out what it does, how we can help. Okay, this is a little assembly line, all right? Things in the body are like assembly lines, just like we're making a car, okay? We get the frame, we add the wheels, we add the seats, we add the seatbelt and the blinkers, you got your car, all right? Most things in the body happen as an assembly line. What we're gonna be talking about today is the vitamin folic acid, or folate. Okay, so let's walk through this assembly line. First, you get folate or folic acid, okay? Folate or folic acid is in many of our foods, it's in many of our vitamins, and that is really important for many parts of the body. One of those parts it's important for is the brain. So folate or folic acid turns into something called folinic acid. Now this is the same as leucovorin, which is the pharmaceutical brand of folinic acid, but they're pretty much identical. Folinic acid, leucovorin, pretty much identical things. I'm not a huge fan of leucovorin because many of the forms contain gluten, so if you're really gluten-free, you're gonna want to avoid that. But folinic acid or leucovorin eventually converts into something called methylfolate or 5-MTHF. The pharmaceutical form of that is known as Deplin. So Deplin is the pharmaceutical form of methylfolate, 5-MTHF. Exact same thing, except it contains a lot of other stuff like colors and soy and other kinds of inactive ingredients that who needs it. But these are the different forms, whether you get it as a vitamin, whether you get it as a pharmaceutical. In order for the folinic acid to turn into methylfolate, it uses the MTHFR gene. So that MTHFR gene converts folinic acid into methylfolate. So it's a very important step that you need to have inside the brain to work. Now that we know what that MTHFR gene does, why does that matter? Why does methylfolate matter, okay? Because methylfolate is a key ingredient into the formation of chemicals in the brain, such as serotonin and dopamine. Now, we want lots of serotonin and dopamine because those are going to help us be happy. Those are going to help us talk. Those are going to help us with our focus and our concentration. Those are going to help us with our sensory issues and our mood and our sleep. These are really important chemicals in the brain that we need. Now, I test for these chemicals in practically all of my patients, have for 2 decades. A lot of the times these will be low. Why are they low? Okay, and when these brain chemicals are low, you're not sleeping, you're not happy, you're not talking well, okay? When these things are low, like serotonin and dopamine, it could be because of an MTHFR genetic problem because you can't push down this assembly line, all right? So that's why these things are all important. So how do we intervene? Intervening is really easy, and this is just part 1, okay? There's 2 parts to this puzzle. Most people focus on part 1. We need to focus on both parts. I'll show you why. Okay, you can either give somebody folinic acid or you can give somebody methylfolate. So you can take folinic acid, you can take methylfolate as vitamins. You can take leucovorin and Deplin as pharmaceuticals, but you can take those as vitamins. What you'll do when you take these vitamins is the brain is going to produce more serotonin and more dopamine, okay? That is going to help us with our focus, with our language, with our sleep, with our concentration, with our sensory issues. So it's so important for so many different things that we need this whole pathway working. We just have to decide where are we going to intervene. Are we going to take folinic acid? Are we going to take methylfolate? Or are we going to take both? Okay? So let me pause on this. I'm going to finish the rest of this assembly line in a little bit, but let me segue over because now we've got a good, decent understanding of this MTHFR gene. All right, this MTHFR gene eventually produces chemicals in the brain by helping folic acid turn into its active form of methylfolate. So folic acid, MTHFR gene creates methylfolate, goes down and creates the different brain chemicals. I see so many great questions coming up on this. I want to answer them all, so I'm going to get to them very soon. So we can intervene with those things. All right, so let's review some research studies on that. This is a research study on the potential use of folate and its derivatives in treating psychiatric disorders. And what it was found is that different folate things like folinic acid and methylfolate have great improvement in psychiatric health conditions such as autism and ADHD, not to mention postmenopausal depression, schizophrenia, bipolar, etc. But they were giving methylfolate in this research study and showed improvement in psychiatric conditions across the board. Now, I was looking for research studies specifically on methylfolate and folinic acid for autism. What's interesting, I found 0 research studies on methylfolate in autism, which I find kind of surprising because so many people are using it. But we understand why, we understand the process. There are a good number of research studies on folinic acid and autism, okay? We can assume because folinic acid goes through the MTHFR process to become methylfolate, we can assume if you're giving folinic acid, you're getting a decent amount of methylfolate in the body and brain. That does depend on the severity of MTHFR mutations you have and other epigenetic issues, but you get the idea. Treating folinic acid or methylfolate should be pretty similar, except for side effects, which we'll get to later. So here's a research study on folinic acid improves verbal communication in children with autism, double-blind, placebo-controlled study. We got Dr. Fry here. Dr. Fry is big in the autism world. He's great. He did this research study, and again, you see improvements in verbal communication. That's fantastic. Here's another one. Folinic acid improves the score of autism in this placebo-controlled trial. So we have global ADOS scores as well as social interactions and communication improved significantly with our folinic acid group after 12 weeks. That's amazing. 3 months to better language and better behavior. How easy could that be? Okay, moving on. Folinic acid as an adjunctive therapy in the treatment of inappropriate speech in children with autism, double-blind, controlled placebo trial. And what we see here is a significant effect that helps with inappropriate speech and stereotypies and stereotypic behavior, as well as, hold on, I'm sorry, I can't read backwards, inappropriate hyperactivity and non-compliance. My wife often says I have inappropriate non-compliance as well, so I understand maybe some folinic acid will help me. So, decent amount of research showing the folinic acid, and therefore presumably the methylfolate, is going to help our kids with their language, with their behaviors, minimally, okay? So this is great. Now, many people have tried these things and said, hey, they work. Awesome, great, that's what we want, okay? We'll show you our supplements, with folinic acid and with methylfolate to kind of show you how we can get those. But half the people who take these get a child who's more hyperactive, who maybe has sleep problems, more aggressiveness. Why does something like folinic acid or methylfolate help certain kids, but other kids it causes side effects? Because that is the problem that we need to get around, okay? Let me go back to that flowchart. Let me go back to that assembly line and walk you through it, okay? Remember, folic acid or folate becomes folinic acid, goes through the MTHFR process to become methylfolate. That creates all those good brain chemicals, serotonin and dopamine, which help with the language and the behaviors and the stereotypy. Awesome. Now, here's the next step, and this is what most people don't think about while we're doing methylfolate or folinic acid supplements or B vitamins and such. You got to think of the second part. While we're producing all those chemicals in the brain, like serotonin and dopamine, where do they go? Okay, our brain uses them, but then it gets rid of them. All right, you don't just keep this stuff forever, you're gonna pee it out. All right, these brain chemicals get urinated out as different organic acids. So if you've done an organic acid test, you've probably tested 5-HIAA, HVA, and VMA. If you've done organic acids through a regular lab like Quest or LabCorp, it's going to have them. If you've done them through Great Plains or Genova, it's going to have them, okay? These are going to be on that test, whether you've seen the answer or not. So if you've done an OAT test, you haven't seen these, go back and take a look. They're gonna be in the neurotransmitter category. So these organic acids get urinated out. They go through their own genetics. So all that serotonin and dopamine just doesn't leave the body, it's gotta get converted. Just like folate gets converted. It gets converted with these other genes, COMT and MAOA. So first step, we have to make all this stuff. Second step, we have to get rid of it, all right? It's just like using a toilet. That thing better flush before you add more to it. So when you're taking B vitamins and you're getting side effects of hyperactivity and aggression and sleep problems, it's because you can't get rid of it with the COMT and the MAOA. So you have to treat these things first before you treat the MTHFR, or else you may get those behavioral issues. All right, so let's get into kind of a more of what I can do right here, right now for you guys. First off, what is your genetic status, okay? You may want to do this type of gene testing for MTHFR, COMT, MAOA, and other genes. If you haven't had that done yet, we do have that genetic test on our website. It's called the Genetic SNP test, SNP. There's a lot of companies out there that do this kind of testing. This is the lab that we use, and we're gonna, anytime you order a lab from us, I'm gonna write up an interpretation as though you were a patient and tell you exactly what it means, exactly what I think you can do. So that's a great thing. If you haven't done that testing yet, look at our SNP test to get that info. Now, if you haven't done that testing yet, that's okay. What we can do is start to trial and error with different supplements. So number one, you can always start with a folinic acid or a methylfolate. Now, we've got a couple in our line. We have our Power and Focus supplement. This is our #1 bestseller, and I think it's because it works the best. In here includes folinic acid and methylfolate. So it has an 80-20 ratio of 80% folinic acid, 20% methylfolate, which will help, and is along with the 80-20% of B12. So it has 80% hydroxy B12, 20% methylated B12, because that's going to reduce the odds of side effects. Okay, so that's a place that you can get them. Also, if your child doesn't like taking supplements, which happens, in fact, I just saw something fly by on the comments that said, hey, my kid doesn't want to take these. I get it. Our kids are sensory. They're picky eaters. They don't want to put stuff in their mouth. I totally understand. We do have some creams that can help. So we have an MTHFR cream. So you don't have to use the actual product, the actual, oral product. Now, this includes includes B6, B12, methylfolate, and all the other stuff that gets through the skin into the bloodstream. So you can use a cream if you don't want to use the oral. Now, we also have something called super folinic acid. There's a lot of folinic acid products out on the market. We were working on building a better mousetrap. We worked with a PhD from Cornell whose life's work is folate and folate receptors and how to get this into the brain, across the blood-brain barrier. And we created what I think is a better formula that has extra ingredients with folinic acid to get it into the brain. And we've seen a lot of better improvements with our combo versus other folinic acid supplements. anything is worth a try. Now, let me show you what one of those extra ingredients are based on our research. Here's a research study that says the upregulation of reduced folate carrier by vitamin D enhances brain folate uptake in mice lacking folate receptor alpha. Wow, that was a lot of big words, but basically what it means is in order to get folinic acid into the brain, it needs to be chaperoned, okay? Just like our kids, we're gonna drive them to speech therapy. We're gonna, they're not gonna walk there themselves. So it needs to be guided. One of those things that helps it and helps activate the receptor that brings it into the brain is vitamin D, okay? So we have vitamin D in that combo powder with folinic acid so we can work at the same time as soon as it hits the receptors in your gut, and it'll start to absorb. And then into the bloodstream, into the brain, good absorb across the blood-brain barrier. So there's a couple others there in our super folinic acid formula that can help with that absorption into the brain, and then hopefully better language, better behavior, better stimming, as the research shows. So those are the different ways that you can get this stuff into your kid. Again, if you want to do a genetic test like a SNP test, we've got one on our website. There's others over the counter. If you want to start supplementing, start with a blend, folinic acid methylfolate combo, like our Power and Focus. Our MTHFR cream, if your kid doesn't like to take pills. And if you just want something a little more targeted, we also have a chewable tablet called B-licious for MTHFR, which is just B6, methylfolate, and B12, but without the folinic. So different options for different things you may need. One other thing, those are our supplements to get the folinic acid and the methylfolate into you. But what about this here? Okay, what about the COMT and the MAOA? So if you have the COMT or MAOA gene mutations, if you take B vitamins and your kid gets hyper, odds are you've got this COMT and MAOA mutations, okay? What to do then is to use our supplement called anger management. Now, anger management helps reduce those side effects from B vitamins because it activates that COMT and MAOA and genes, activates those enzymes, and reduces the hyperactivity that you can get. Now, we are out of stock of this stuff. We're not going to have it till the end of March, beginning of April. However, it's something that you can do eventually down the line. All right? So I hope that paints a big picture. Somebody just asked a question. I'm going to shout out the answer now. What supplements can you be on when you're doing a genetic test? Okay, you can take any supplements on a genetic test because your DNA is your DNA and always will be your DNA. So it doesn't matter what you're taking. You can't change your DNA. You can change the function of it. So feel free to stay on all your supplements if you're doing that SNP test or other genetic tests. All right, let's get the coupon of the weekend. Let me do a review, coupon of the weekend, and then we'll answer some questions. MTHFR is a gene. Okay, it is one gene out of 20,000 plus genes that we have. It is more abnormal in kids with autism than the average person. However, the average person has a 50% odds of having an MTHFR mutation. So it does not cause autism at all, period. But it does increase the risk factor, all right? Stacy just said, do you work with kids with MTHFR? Yes, most of my kids are MTHFR mutated. So yes, I work with them all the time. What do you want to do if you think this is a problem? Okay, you can either test with a genetic SNP test. We got one on our website, like I mentioned. There's others out there on the market. Get the SNP testing done. If you don't have a SNP test, or you just want to start with supplements, or you have a SNP test, you just want to start with supplements, what can you use? Okay, number one, make sure that toilet flushes. Make sure if you do have a B vitamin sensitivity, you're either giving very low dose B vitamins, or you're flushing the problems down the pipe. That doesn't sound very good, does it? But you're getting rid of the extra brain chemicals that are causing those side effects. Try our anger management supplement. It's out of stock. We'll have it back in a month. When we're giving folinic acid or methylfolate, if you just want something, Andrea just sent 530 stars. Thank you, Andrea. Facebook stars are a way to donate money to a Facebook Live speaker. We take 100% of our Facebook star money, pass it on to autism support groups like TACA or Autism Hope Alliance. Now, if you want to try folinic acid or methylfolate supplement, then we've got a few for you. If you like chewables, we have a chewable tablet called called B-licious for MTHFR, B6, methylfolate, methyl B12. Simple, targeted, easy. If you want a folinic/methylfolate blend, okay, try our Power and Focus. It's got a blend of the two. If you just want folinic acid, we have our super folinic acid supplement. I don't have one here. We're out at the office. We do have it in stock on our website. And if your kid doesn't like to take stuff, try the cream, okay? MTHFR cream, rub it on a pump before bed, or in the morning, actually probably be better because the B vitamins are stimulating, and see how your kid changes. So, why would you do all this? Because based on the research, you can get more language, better behavior, and less stimming. And those are all great things to try to get, okay? Now, don't forget, all of our supplements on Spectrum Awakening has a 30-day return policy. So if you've tried stuff and it doesn't work, or your kid doesn't like the taste, I just saw a comment go up that my kid doesn't like the taste, I bought all these supplements. You got 30 days to return it, okay? I would rather you try something and send it back than not trying it at all, because there's too many things out there that could help your kids, and I want to help you try different things. So you try it, you don't like it, it doesn't work, I don't care why, send it back, return. Holy cow, there's a big star on my screen. We just completed a stars party. So thank you for all the Facebook stars you donated. I don't know what happens, but we made a stars party. That's great. Thanks, Facebook. It's like little hits of dopamine just jumping at me from my